Hey, good morning, everyone. We are, I think, still gathering. I think there are two sessions going on right now at the same time, and so our audience is going to be split. May remain a little bit small today, but I hope that we can still use this time in a way that is worthwhile and a little bit interesting and entertaining. I'm Michael Ames. I'm Senior Director of Healthcare and Life Sciences for SADA. I'm going to tell you a little bit more about SADA at the end. We're a Chime sponsor, but this isn't a sales pitch presentation. Suffice it to say, in the short term, we're a Google Cloud consultancy, and my responsibility is helping to shape SADA as an organization that serves the needs of the healthcare and life sciences industries as effectively as possible with Google Cloud tools. But today, you are here helping me nurse a very difficult emotional experience I've been having for the last year, which I can illustrate for you here with this slide. What you're looking at here is the front page to a website called the National Response Portal, which hopefully some of you know of, have looked at, have used. It was a combined effort between my organization, SADA, Google Cloud, and HCA Healthcare to try to bring, in the early days of the pandemic, a crystal clear view of some of the key pandemic metrics, like number of cases and number of deaths. We have metrics in here on mobility, how people are getting around, whether or not there's social distancing. We have predictive models for where hospitalizations and deaths will be occurring in the next few weeks. It's a fantastic tool, wonderful resource. And if you haven't been there, I encourage you to go to nationalresponseportal.com and take a look at it. Here's the problem. My job as the executive sponsor for this project is to get up every morning and log in and make sure that the thing is running, and double check the readout logs and the cron jobs and make sure that the data got loaded and everything is there and ready for the general public to consume for the day, which means I start my day every morning, sometimes while I'm still lying in my bed looking at my phone, watching these charts. And that means that my mindset every day is on what is happening in COVID. And I work across a lot of different partners and customers in the healthcare industry who are deeply, deeply concerned with how we respond to the pandemic appropriately. That's what we've all been doing for a year, and that is what we should have been doing for a year. But when I got a chance to give a presentation here for HealthIMPACT, I realized I could not do one more presentation, one more talk on what we're doing about the pandemic. And that's where we came up with this title, that this presentation is really anything but COVID. It's what are we doing as an industry to continue to innovate, to continue to improve patient experiences, to make our impact on the world, in spite of the fact and concurrent with the fact that we are doing response to a major international pandemic. So that's what this is going to be about. And I'm going to take you through a bunch of information and some case studies and some examples. I want to give the disclaimer up front. I'm not laying claim, SADA is not laying claim to all of the good work that we're going to show here. This is about work happening in the industry. Some of these things we have been involved in, and I'll mention those when we get there. But we're going to look at things that have been done that didn't have anything to do with COVID-19. And here's the first thing that I was amazed by when I started looking more closely at this. This is Rock Health's analysis of funding in the digital health space. The green line is 2020, and check that out. $14 billion in digital health innovation invested in 2020. It's amazing. It's 50% more than what we saw last year. It's almost twice what we saw last year, 50% more than the previous high of 2018. I'm looking down there at 2013 when funding was $2.1 billion. I remember 2013 like it was not that long ago. We were in the early stages of all kinds of interesting healthcare innovation at UC Health, and did not realize then that we were just scratching the surface as an industry of how hard we were going to push to improve healthcare and patient experiences. So this is exciting to me. The other thing that's really interesting, and I think helps to explain a little bit of what we're going to see, is that fully a third of this funding, at least by the halfway mark of the year, we don't have data for the full year yet, but at least by the halfway mark, fully a third of this funding, which was by far and away the biggest portion of the funding provided, was coming from healthcare providers, as opposed to VC firms, as opposed to other kinds of investors and banks and other things like that. It's healthcare providers are the major driver of funding for digital health innovation in 2020. And I think about it, and in a way, it kind of makes sense, right? Because if you're in strategic leadership in a healthcare organization, which many of you are, and there's a pandemic on, you know that your hands are going to be busy all that time dealing with the pandemic. But you also know that it's going to come to an end, and that we can't put a pause on innovation, because what happens when the pandemic is over? Are we starting back at zero? You don't have the resources to go drive that innovation yourself. And so what do? We direct our wallets into the venture funding innovation sector to try to make new and exciting things happen. And I think that's really cool. I think it shows the forward-thinking nature of the healthcare industry, that even while we've got a present crisis right now, literally and figuratively, a patient on the table in front of us that we've got to take care of, there's a part of our mind that is thinking about what's going to happen next. And we can't drop that ball, because we're going to solve this problem and there's going to be another one, and we've got to be ready for it. So I'm going to take you through some examples of the kinds of innovation that have been happening underneath, behind, and beside COVID-19, putting these into a few different categories. The first one is improving the patient experience. I'm going to show you 3 different examples of very cool innovations that have happened in the last year that you may have heard about in the news, or you may not have. This one I just loved, because sometimes it is the simplest things that make a big difference. Children's Hospital of OC ran an experiment where they embedded a QR code onto the cast of children who were leaving the hospital. And that QR code linked to information on care and recovery, how to take care of the cast, what to do for their recovery. Super simple, right? Not an expensive kind of activity, doesn't require a huge change in procedures, and they got great results from this. They measured back improved patient compliance. There were fewer calls to the doctors or nurses, and the patients themselves were really satisfied. They love the idea that if it's like, there seems to be something wrong with my cast, can I go swimming with this? What happens if it gets too hot or too itchy? A parent can beep that QR code, and there's the information that they need. Simple, straightforward, meaningful innovation. And I got thinking about, why don't we do this in more cases? Why isn't there a further information QR code on every prescription bottle or box that gets sent home? What are the other things that we provide to patients that are with them all the time that they've got a question about? And if they have questions, we could give them immediate access to their data, improve their experience, and free up those crucial phone call doctor and nurse resources. Here's another one. This one SADA has been directly involved in and supporting, and so we're excited about it and we're proud of it. Camino Health, which has a special place in our hearts as Google consultants, is known for delivering the most Google babies, because they're right there in Mountain View. So little baby Googlers are born at El Camino, and we've helped them to create a new digital front door mobile app, runs on Android and iOS, and is the beginning of a really broad vision that El Camino Technical Leadership has for a single point of contact for patient engagement. Everything from how to find us, interoperability with their medical records system for calendaring, scheduling appointments, to beginning to work on surgery prep, post-op information, wayfinding, both GPS to the site and around the building once you're within it. This is something that more and more healthcare organizations recognize are important for patient engagement. And again, in the midst of a pandemic, El Camino figured out how to maintain priority enough in order to get this thing built and launched. It's out there in the wild now. We're excited about it, and we're excited about where it'll go next. Here's another great one. Some of you might know the news because it's been more or less continual source of good news out of Banner Health and the work that they've been doing implementing chatbots, starting out with their emergency department, giving patients coming into the emergency room the ability to basically scan a QR code, and now they begin a conversation with this chatbot that is helping them with their intake forms and giving them information about how long they'll be waiting and what to expect next and when it's time to go to their appointment room. Lets them ask questions. What's happening? How long is it going to be? Can I talk to a nurse? And again, an innovation that is very pleasant for the patients who report high patient satisfaction and is improving throughput in the ED, while then freeing up human resources in the emergency department to do the important work that they've got to do. This year, they said, let's take this idea that's working really well and expand it out into the concept of a virtual waiting room for other departments. So appointment reminders, again, intake form completion, link out to telehealth, information about where to go next. And we're excited to see where Banner continues to drive this area. We think that there's a lot of potential for chatbots as a user interface between the patient and their healthcare experience. I want to pause now because we've had a few more people join and just sort of recapitulate here that what we're doing is we're taking a retrospective look at some of the amazing health tech innovations that have occurred in the last year that don't have anything to do with COVID-19. And again, frankly, it's therapy for me, being responsible for a major COVID-19 data reporting portal, to have a chance to talk about things that are not COVID related at all. And what I'd really like to do when we get to the end of my part here, which is just maybe another 6 or 7 slides, would love to open it up for folks either via the chat or verbally to just jump in and share within your organizations or what you're seeing that you have done in this last year that isn't COVID-19 related, that's continued to push forward in innovation in a way that is going to help the industry to continue to succeed even after the pandemic has come to a close. So be thinking about that now as I take us through a few more interesting examples. So there was a collection, probably more than we could spend an entire hour on, in the way that scientists and research organizations are applying AI to help with diagnostics, and specifically to make diagnostics faster, simpler, cheaper, and easier, better experience for the patient and for the provider. I'm going to give you a few examples here. All right, so we're getting pretty sciencey here. This was a study and a project done in the context of breast cancer, looking at both microscopy images of potentially cancerous tissue, which for a while now, we've had good AI that can help us to identify cancerous cells and can help us to help a pathologist to do a better job in diagnosing based on the visual appearance of the cells. Here's what's exciting about this. They're looking at the cells, and then also based on cells, they've trained an AI model to be able to predict genetic traits within those cells. So things like methylation, copy number, not specific sequences because that's really, really small, but based on the visible traits of the cells in the microscopy images, then being able to reveal with very high accuracy, 95, 96%, certain genetic traits that sit underneath that. Which is exciting because in the course of cancer diagnosis, often you need both of those things. You need the view, you need the molecular data underneath. It's tough to get the molecular data out of things that you've put in a slide without destroying the material that you need for the slide. And here's a solution that in one process, from a pure computational process, is able to produce both those sort of physical morphological traits and genetic traits. And this is something that I think could develop into some new, really exciting, more efficient ways to help in cancer diagnosis. Next example, this one's near and dear to my heart, as this is a SADA customer and partner. Gnome is an organization working on blood tests to help detect cancers, a variety of cancers, focusing first on colorectal cancer. And this is a really interesting image from a poster that they produced that sort of shows cancer developing in various stages, right? And we all understand that things grow in this way. They already have a blood test that can detect stage 1 and 2 colorectal cancer with like 94% accuracy, which is really exciting because that creates an opportunity for screening tests with a great deal of sensitivity and specificity can help to identify this cancer and may ultimately reduce the demand for things like colonoscopies, which we would all appreciate that, right? Let's be honest, we'd all rather have a blood test. What's interesting is they backed up and they said the earlier we can catch this, the better. If we can catch an advanced adenoma, which is predictive of the development of future potential cancers, the improvement in health and survival is like 60 times. So how do we do that? Adenomas release different kinds of signals, right? You detect an adenoma more by looking at what's happening in the body's immune system than you do by looking at the DNA that's flowing from the tumor itself. So they've got a multi-omics analytics approach that is able now to detect those advanced adenomas at 41% sensitivity, 90% specificity, which again, ultimately, as a screening test, can be extremely helpful now in catching colorectal cancer much, much earlier, greatly improving the survival rate of folks who are showing those signs in that early stage. And all of this is done with some fantastic scientists and analytics happening up on Google Cloud, and we're really proud to be playing a small part in it. One more here in this ML to improve diagnosis. And again, the theme here is every time we make an advancement along this area, we end up creating diagnostic processes that are simpler, cheaper, less invasive to the patient, easier for the healthcare system to administer. This one I found really interesting. Genetic diseases in children are something that often will take, especially rare diseases, weeks or months for a diagnosis, during which time there's a lot of uncertainty and concern in the family and the parents, and potentially missed opportunities for appropriate treatment. So universities in California, Calgary, and Colorado took an approach. Many of these rare genetic diseases affect multiple organ systems and will actually have an impact on facial features. They developed a machine learning model that with a very high degree of accuracy off of a 3D facial scan is able to predict the presence of some of these rare diseases in children and can do it almost instantly. It can, with like 96% accuracy, tell you if that child has one of these rare diseases, and it's something a little bit less than that, but still very predictive, point to exactly what that disease is. So imagine a diagnosis that used to be for a child, a blood draw, something that has to be sent into a lab, everything smells antiseptic, and it's scary for that child, and it might take days, weeks, months to get results. Now that child and their family can have an experience that's really not any more uncomfortable than a photograph in order to help to identify the potential presence of these diseases. That's an exciting thing that improves quality of care for everyone. Moving along, third category, and getting a little bit nearer and dearer to my heart, is how do we access data and teams? How do we collaborate better and stronger? Some of you might have seen the news a little bit recently from Ascension and Google and the work that they're doing to drive EMR search. To be really clear, Google is not building and not interested in building a medical record system. They're interested, as has been their history since the 90s, in figuring out how to make data in systems more accessible to the people who need them. There's a new tool under development now, not ready to be marketed or used anywhere else, so still very early stage, that is an overlay to Ascension's EMR systems that provides Google-like, because it's Google, simple and instantaneous search to patient records in that system, of course, to authorized providers only, and all private and all secure, with some really incredible overlaid analytics to help a provider instantly get to the data that they need about that patient from a complete longitudinal view, see it as conveniently as possible in text, charts, graphs, and to be able to help guide them very quickly into the information that they need to make the decision that is important in that moment. This is exciting stuff. Again, complementary to whatever EMR is being run, Ascension and Google really working hard to kind of push the envelope here to say the data is there. The problem is usually, how do we find it? We think Google is better at finding data than just about anybody, and they've been making some great strides this year during the pandemic. Another one near and dear to our heart, because this is a direct SADA customer. This is actually hot off the press because it was like yesterday. We flipped the switch and migrated 40,000 users at Hackensack Meridian Health to Google Workspace from off of Microsoft Office. And I have to say that this seems like a small thing because that's administrative, it's back end. Aren't we talking about the way that people do docs and spreadsheets, and all of them look the same? And that's true. But part of the reason why I care about and work in Google for healthcare is that the more that we can streamline collaboration, improve access to data, the better outcomes that we get. We get less physician burnout. We get more focus and concentration. We get the information that you need where you need it at that moment. And we see again and again the impact that these tools can have. So really excited to be working with Hackensack Meridian on this, how they managed to pull off this migration in the middle of everything else that is on their mind. Serving patients in the New York, New Jersey area is amazing, and it is a tribute to the commitment, the innovation mindset of their leadership there. And it opens up other opportunities. In addition to improved collaboration, now we have minimized malware attack surfaces, so less likelihood of dealing with ransomware that can shut hospital systems down, and more opportunities for clinical innovation. So we're working with them on new nursing kiosks and integration with Imprivata, tap and go, get the information that you need where and when you need it. And then the last, this is one technical, one a little bit less technical, but it came up so often in the news that I felt like it was really warranted for this discussion. The first is, this is really around healthcare taking on its cultural responsibilities. A little sideways here, TikTok isn't a healthcare company, but honestly, there's a Best Buy Health, there's an Uber Health. Why not have there be a TikTok Health? Really impressive when social media organizations step up to try to do the right thing. And there's a recognition that social media, especially social media that appeals to the younger generation, is often the source of psychological difficulties, eating disorders. And TikTok has done interesting things like integrate. You can't really see it very well, but someone here on TikTok has searched for the word pro-ana, which is sort of a contraction code for pro-anorexia. And when you put that in, what you get are a series of helps and warnings and information about anorexia and where you can go for help, rather than a series of things that might encourage you down a negative path. This is just an example of how social media is starting to understand that they have an impact on health and that they have a responsibility to alter their behavior in order to play a role in improving health. And of course, this last June, during the Black Lives Matter protests, there was a great deal of awareness raised about challenges in racial equity across our country. And it was exciting to see healthcare organizations, from scientific journals to major hospital systems and others, come forward and sort of lay down the line and say, here is what we are going to do differently, and this matters to us, both in terms of how we hire and treat the people who work for us, but also a recognition that we need to do better in making sure that healthcare research reflects the needs of a diverse genetic base and diverse races. And it is easy to be skeptical about this, right? To say, well, what major company didn't release some culturally appropriate statement in the month of June last year? And that's true, but I actually believe that healthcare is different, and it's part of why I'm here. It's the only industry that I know of that, from its inception, literally Hippocrates, thousands of years ago, saying it matters how we operate. There's a code of ethics to how we do this. And I don't know many people who are working in the healthcare industry who aren't here, in part at least, because they want to be part of this greater good. So I believe in this industry and in its ability to actually step up to these commitments. And it starts with a commitment and a press release and a blog article, and those things are good. And then I believe that since then we have begun to see really interesting actual change occurring in both research, life sciences, and clinical care. So exciting things. It really, if we took COVID-19 out of the equation, we would look back and we would be so excited at what we as a healthcare industry managed to accomplish. I've given you just a few examples out of the hundreds that I looked at and selected from for this presentation. And I think we should be immensely proud of being part of something that is so important and so good. Just very quickly, again, SADA, Google Cloud Consultancy, we're here to help you with your healthcare data, infrastructure, innovation needs. We've got a strong reputation with Google as their partner of the year. If you come to Google and say, I need help with healthcare, chances are very good they're going to refer you to us to help you get there. And we're a fun, hardworking, bold, and innovative company. And we're just really, really happy to be able to be part of great organizations like HealthIMPACT, and really happy to be able to work with fantastic folks like you who are doing the hard work out there in the field. So with that, I want to pause. I think we've got 3 or 4 minutes left, and I would really like for any of the participants still on the phone, first of all, if you've got questions about anything that I covered in this, would love to hear them. Second of all, I would really love to hear things that I missed that you think are important, whether they were from your organization or from somebody else's. So Andrea, who's helping to moderate this, she indicated that if you want to participate, you need to click your microphone button, which is in the top left of the screen. And then Andrea, I don't know if they need to also click the live button. If you want to participate verbally, please jump in and share. And if you'd rather just like type something into the chat, then we'll watch the chat. Yep, so there's a question here about having my email for follow-up. That's no problem. I'm putting that into the chat now. Michael.Ames@sada.com. Would love to talk to you. We'll give 30 or 45 seconds here to see if anybody else has anything that they would like to share. Megan is asking about my talk or the panel discussion yesterday, and which was on the theme of love at first bite, when you knew that your analytics investment was worth it. And do I have a favorite love at first bite story? I told my 2 or 3 little kind of lighthearted vignettes in the middle. If I were to think about a serious one, well, let me tell you the thing that I'm really proud of that I didn't go into detail on. At the time that we were doing, silly research into Colorado cultural norms, we were actually building a team and a project there that sat in between UC Health and Children's Hospital Colorado, built a big integrated clinical data warehouse incorporating data from Epic systems from both of those hospital systems, about 7 million patients, and an analytics layer on top of that. And it was fantastic. And at the time that I left about 1.5 years ago, that team was nearing delivery on 1,000 individual curated data sets to help researchers and hospital administrators working on healthcare research and quality and administrative challenges across all disease types and all types of healthcare challenges. When we think about that, over the course of 3 or 4 years, 1,000 potential projects impacted by the work that we did, bringing that data together and serving it out to people. That's something I'm really, really proud of. Question here about that digital front door available to use. Whom do you contact? Prasad, send me an email, michael.ames@sada.com, and we'll talk about what those possibilities are. And with that, folks, I think that we are at time. And I really appreciate you coming and sticking around and taking this sort of refreshing journey with me. Hopefully it was refreshing to you, hopefully optimistic. I'm really excited about the future. Hope that we get to work together in one capacity or another at some point. Reach out anytime, and we'll talk soon. Please enjoy the rest of the conference.